Hi everyone, this is Norma Trinidad, Assistant Workshop and Outreach Coordinator. We're very excited for this Facebook Live for all of the community that are English speaker. We do have representation from one of our partners that always like to provide presentation to the community on our social media page. We are live on our Facebook and also on YouTube. Hola, buenas tardes, nuestra comunidad en nuestras redes sociales. Mi nombre es Norma Trinidad, asistente coordinadora de talleres y alcance. Les queremos informar que esta presentación se hará solamente en inglés. Así que los invitamos a que nos vean en vivo durante la presentación, que vamos a estar tocando un tema muy importante, pero les queremos recordar que esta presentación solamente se hará en inglés. Okay, once informing our community that this presentation will be only in English, we still invite our community to stay along and view this live since it's going to contain important information for our community. For those that are known of Civic, we are a nonprofit organization offering immigration services as well as information related to health and entrepreneurship. We invite you to also visit our website at www.vallecentral.com.org. For those that are unknown of the information that we have, we invite you to join and visit our website, since we have majority of information posted about our daily activities out there and within the community. Also, the dates that we have already established for the, immigration workshops. For those that would like to visit our website in English, we do have one that is www.civic.org. That web page is also in English, so you're welcome to visit us for more details about our services free of charge. So I'm going to go ahead and pass it on to my coworker Ingrid, that she's going to be introducing herself, as well as our partner organizations that are going to be providing information about oral health. Go ahead, Ingrid.
Thank you, Norma, and thank you everyone who's tuning into today's live broadcast. My name is Ingrid Salazar, and I am the Health and Immigration Community Educator here at Civic. So as my colleague mentioned, we are a nonprofit organization based here in Fresno, but we do serve all of the Central Valley. And I also want to remind folks, please follow us on our social media. As you can see on displayed underneath is our handle. So we're at Civic Fresno. So please go ahead and follow us. Not only do we have our Facebook page, but we also have Instagram, Twitter, and we're also live broadcasting on our YouTube channel. So this will stay recorded and will be archived in both our YouTube channel and our Facebook page. So if after today you have any questions or want to go back to this information, just know that this will be saved and you can go back to that as a resource. So this is not only for you, but for you to also spread the awareness and share this information with any family or friends. They may find this information beneficial. So I'm going to pass it over to one of our first presenters to introduce ourselves, and then she can popcorn it off to one of the other two. Want to remind folks that today's presentation is on Fresno County's local oral health program. So they'll be providing more information on that. But Jodeci, if you'd like to introduce yourself.
Thank you, Ingrid. Hi, everyone. Thank you for joining us today. So just briefly introducing myself. My name is Jodeci Felix. So I am a health educator and project director overseeing our local oral health program here at the Department of Public Health. So yeah, we're excited to be here and provide you with a lot of really good information. And I'll pass it over to my colleague, Becca.
Good afternoon, everyone. My name is Becca Kirkish. I'm a health education specialist for the local oral health program here at the Fresno County Department of Public Health.
Good afternoon, everyone. My name is Hannah Hur. I am a health education specialist here at Fresno County Department of Public Health in the local oral health program. Thank you, Civic, for having us here today.
Thank you, ladies, for introducing yourselves to our community. Now, before we get started on the presentation, I just want to remind folks who are tuning in that you can share your questions or comments in the comments section of both our Facebook or YouTube channel. So wherever you're watching this live broadcast, just feel free to input your questions or comments, and we'll be sure to go over those at the end of the presentation. Also, once again, just know this will stay recorded, so you can always go back to it and have it as a resource. But take advantage now that they are here live today to be able to answer your guys' questions. So without further ado, I'm gonna transition to the PowerPoint so that we can get started.
Thank you. So as I mentioned, here's a little bit more information to our team. We do have our emails on there, but we will be providing our contact information towards the end of the presentation. So we have a couple of our nice pictures here. You can see our nice smiles. So we'll go ahead and move forward since we went through the introductions. So a little bit about ourselves. So the local oral health program is a statewide program. So this was established in July 2014 in efforts to improve the oral health of all Californians through prevention, education, and organized community efforts. We are funded through the California Department of Public Health. And through these funds, our local oral health program aims to really create and expand capacity at the local level. So being able to educate, prevent, and provide linkages to oral health services and care. So some of our partnerships include collaborating with our local health department, local community-based organizations such as Civic, dental hygienist consultant, and we also work with schools surrounding Fresno County, mainly elementary schools from grades K through third. So our local oral health program does conduct community outreach in both urban and rural communities, and we provide resources to help find a dentist or to also secure low-cost dental services. In addition to that, we provide oral health education to children, families, expecting mothers, community-based organizations, and schools and libraries. Next slide, please. So this is a really good resource that I encourage you to utilize. So Smile California is a public health initiative that's provided from the Department of Healthcare Services. The goal of Smile California is to promote oral health and increase the awareness of the Medi-Cal program. So if you're covered under Medi-Cal, this provides free or low-cost dental services to eligible Californians. So the program offers a wide range of dental services. So this can include anything from dental cleanings, x-rays, examinations, fillings, and extractions. Smile California does aim to make sure that people, especially like children, teens, expectant mothers, that they have access to dental care. And this will help prevent dental problems and promote overall health. To get a little bit more of a depth look of what Medi-Cal oral health services are provided or covered, or if you need help in finding a dentist as well, you can go ahead and visit their website, which is www.smilecalifornia.org. So as I mentioned, it does promote the Medi-Cal program that provides free and low-cost services for all ages. And I definitely recommend for you to visit the website. To the right of the slide, we do have our Fresno County Dental Resource List, which provides a compacted list of our local health centers and dental clinics and agencies that can additionally provide you with dental resources and services aside from the Smile California website. So if you would like this resource on hand, we can definitely send it out to our partners, and that way they can share this information with you. Next slide, please. Okay, and then I'll hand it over to Becca so she can discuss our oral health hygiene practices.
Thank you, Josie. So as we all know, oral health is essential in all age groups. So here on this slide, we want to highlight some crucial oral hygiene practices, starting first with babies. So specifically before baby teeth come in, it's important that you wipe the baby's gums and tongue, even though they do not have teeth. Milk and foods can still get trapped, and we want to make sure that we're cleaning the surfaces so that germs do not stick into their mouth. And then again, taking your baby to the dentist by their first tooth coming in or by their first birthday is recommended. And you can also talk to your pediatrician more about this too. Next, with our older kids, our youth, toothbrushing should be performed or assisted by a parent until the child is 8 years old, and it is recommended that a parent monitor their flossing up until the child is 10 years old. And this is super important because youth do not have the proper dexterity to reach all of their teeth yet. So basically that means, getting all the way back there to their molars. They haven't quite been able to understand how deep the mouth can go. So we want to make sure that a parent can supervise them. And additionally, youth don't have time awareness. So brushing for 2 minutes, to them, it's like 30 seconds and they think they're done. So having the parent be there is really important to making sure they're getting all the teeth cleaned for the full 2 minutes. And then for children and adults, the 2-2-2 rule is super crucial. So this means brushing your teeth 2 times a day, 2 minutes each time, and then going to the dentist 2 times a year. So this should be followed by children and adults of all ages to make sure that they're maintaining a healthy smile as well as flossing once a day. We can go ahead to the next slide, please. So as Josie mentioned, Smile California has really great resources that are free to the public, and they are also translated into several languages. So we encourage everyone to go to their website and get these resources for yourself, your family, or for your agency. Starting with the one on the left. This highlights recommendations and services that each age group should be aware of, as well as some health facts that will affect oral health from the different groups. So from babies, kids, teens, pregnancy, adults, and seniors. It's important that everyone is aware of their susceptibility to different oral health outcomes based off of their age or like if they're pregnant. On the right side, we do have some brushing techniques and toothpaste tips. So I will briefly demonstrate or kind of go over the toothbrushing techniques. So it is recommended that when you do hold a toothbrush, it is at a 45-degree angle towards your gums. You want to move your toothbrush back and forth, gently brushing over the outer, inner, and the chewing surfaces of all teeth. Super important that you don't forget the back of your front teeth and your tongue, because those will hold germs the most, and food tends to get stuck, even microscopic food. And it's great to think about, a great way to think about brushing your teeth is think of the toothbrush as a violin. So when you're using a soft bristle toothbrush, you want to consider the pressure that you're using on your teeth. So thinking of it like a violin, you're going to be just gently going across each tooth, and you can even do those circular motions to really get those bristles around the gum area as well. And then additionally, for toothpaste tips, so children 0 to 3 years old should only be using a grain of rice-sized toothpaste. So that is very small. It is recommended just that small for those little teeth that they have, and that will start helping them get used to brushing their teeth. And having that little bit of toothpaste with the fluoride is definitely going to make a difference in their overall oral hygiene. For children 3 years and older, they can go up to a small green pea size to, again, get used to that toothpaste in their mouth, getting all the teeth cleaned. And then adults, only a large pea size amount is recommended. So what you're seeing on TV is actually just a marketing tactic because they want you to buy more toothpaste. So you don't need to glob up a whole toothbrush with the toothpaste. It's not necessary. Just that small little dot of toothpaste is going to be plenty. We can go on to the next slide. All right, and back to our lovely Smile California resource here. So this is one of our favorite resources that we take out when we outreach as well. It really just gives a great breakdown of all of the Medi-Cal dental coverages for the family. So as you can see here, it will have the services on the left, and then throughout the remaining of the chart, it has all of the age groups and which services are going to be covered for each. This chart can be found on Smile California at their Covered Services tab. And we really encourage you to take advantage of these services as early as you can to ensure maximum coverage and preventative benefits in your Medi-Cal dental plan. So that is all from me. I'll pass it on to Hannah, who will be sharing some awareness campaigns that we are currently promoting. Thank you.
Thank you, Becca. So on this slide, we'll be talking about the Kindergarten Oral Health Assessment. The Kindergarten Oral Health Assessment, also known as COHA, is a mandatory dental checkup for children entering kindergarten or first grade if they didn't attend kindergarten in the state of California. This requirement ensures that young children receive early dental care, which can help prevent serious oral health issues that may affect their ability to learn and participate in school. Young children having untreated tooth decay can increase a high absenteeism in school. COHA forms are due before the end of the year or by May 31st, whichever one comes first. These COHA forms can be completed by a dentist, a registered dental hygienist, or other licensed dental professional. The form can be completed at a dental office or clinic or screening events such as school-based COHA screening events, which are completed at various locations. If we can move on to the next slide. So for the month of September, we do have Rethink Your Drink. Rethink Your Drink is a public health campaign that is brought to you by the Cal Fresh Healthy Living Program here with the Department of Public Health that aims at raising awareness about the high sugar content in sugary beverages such as soda, juices, or even fruit juice. This campaign is to encourage healthier beverage choices. The Rethink Your Drink campaign does run through the month of September, like I mentioned earlier. The goal is to empower families to make healthier choices by drinking more water and reducing their intake of sugary beverages, which are linked to health issues like obesity, type 2 diabetes, tooth decay, and heart disease. On this slide are a couple of tips recommended to reduce your sugar beverage intake. And if you would like more resources regarding your Rethink Your Drink, you can visit the website. It is uncoverhealthyhabits.com. Move on to the next slide. If you would like to learn more or know more about oral health, please visit our oral health website shown on the slide for additional resources to help keep your family's smile bright. If you have any questions regarding our local oral health program or services, you can send us a message directly from our website. Remember that your oral health is just as important as all other health. We also do want to thank you for taking the time to listen to our presentation. I don't know if time allows, but if time does allow, we do have a couple of moments to take some questions. Feel free to ask us any questions.
Thank you, Jodeci, Becca, and Hannah for the presentation and for sharing this information with the community. I'm sure they're going to benefit and they'll be able to not only take this information for themselves, but also for their family members or any friends. I do just want to let the community know I did share with you all in the comments section a few of the links to some of this information. So we did share the smilecalifornia.org website. I know that you guys mentioned it promotes free or low cost dental services. So if anyone is interested in finding out more information, please visit the webpage. Also, any additional resources on the dental hygiene, there is a link for that that will take you to that information. And then again, I just want to reiterate this information because some folks may not know, but if you are a Medi-Cal member, know that you do have dental coverage. So that's very important. There's a lot of, other than just dental coverage, there's a lot of other services that you have access to that you may not know of. And if you want more information on that, I invite you guys to watch our previous Facebook Lives because we've had some of our partners share some of the other services that they have shared that are available to you all. For now, we don't have any questions or comments. But I do, if okay with you all, I do want to just share once more your contact information, the slide. Is that okay? So if any of you have any questions and want to directly reach out to the team, I highly suggest that you do, but you can also contact me or Norma. We have our contact information on our Facebook page, so you can feel free to reach out to us if you are a Spanish speaker or you have a family member who's Spanish speaker. You can contact us and we can refer that question over to the team and they can get back to us. After all, we are a collaborative organization, and so we want to make sure that, we can provide all the information and answers to the questions that you all have. I don't know if you ladies have anything else to add before we wrap up.
Yes, I did want to mention that so if you do follow our website, which I believe you included in the comments, so our oral health program website, we do have under quick links, send a message. So if they would want to contact us directly, they can also send a message and then we'll be receiving that message as well. So it's on the slide. Definitely, if you are looking for any resources or anything like that, it's under quick links where it says contact us, send a message, as you can see on the slide. So we would just want to thank everyone for joining us today. And we hope you enjoyed our presentation. Thank you.
Thank you. And once again, thank you everyone who tuned into today's live broadcast. Once again, this will stay recorded, so please feel free to look back to this for information or look to it as a resource. But other than that, that would conclude today's live broadcast. Thank you, ladies, for coming on to share this information about the local oral health program. It's very much appreciated. And that will conclude today's live broadcast. Thank you, everyone. Have a good day.
Thank you.